Hi, I'm David Levine. I'm co-chair of Science Writers in New York. With me is my co-chair, Joseph Bonner, who's making this video possible and also live streaming it on YouTube for people who can't join us. My guest tonight is Dr. Sara Bode. She's a primary care pediatrician and the medical director of Nationwide Children's Hospital Care Connection, school-based health and mobile clinics. She is also co-director of the pediatric residency advocacy training at Nationwide Children's Hospital. She serves on the executive committee for the American Academy of Pediatrics Council on School Health and is also the deputy editor for the AAP's Pediatric Care Online. Dr. Bode, do you want to join us? Okay, thank you so much for making yourself available. Dr. Bode, and you're in Columbus, Ohio. So,
yes.
So today in New York City, schools started opening for the first time since, I guess, last November or December for middle school students. So I know parents are concerned, teachers are concerned because they're not fully vaccinated. And we chatted earlier about the CDC guidelines. So what are the CDC guidelines to safely reopening schools, and do you support them?
I do support it. The CDC guidelines, one of the tenets of the beginning of their statement of their guideline really talked about how we really can't undervalue in-person learning for students. So the goal for every community and school district should be to work hard to get every kid back to in-person learning, whether that's hybrid or fully in-person. And the Academy of Pediatrics put out a similar statement that really echoed that, right? That the goal should be for every school to work towards in-person learning. We know for kids, it doesn't matter your age, elementary, middle, high school, that in-person learning environment is so much richer and better for them, for their academics, social emotional learning, a lot of their needs that get met there, whether that's mental health, physical health, food, exercise. I mean, so many pieces of this that are critical to children with their development and their long-term trajectory, right? How they're going to do with secondary education or vocational training, all of those pieces. So this is critical, and we all have to work together towards making that happen.
So Nicole Kristof, the New York Times yesterday, says that as many as 3 million children have gotten no education for nearly a year. And he says, there's another tragedy we haven't adequately confronted. Millions of American school children will have missed a year of in-person instruction, and we may have inflicted permanent damage on some of them in our country. What it doesn't capture is the human toll. Rich kids going to private schools glide on through life mostly unaffected, while low-income children often don't even have internet to attend classes. I'm writing this from rural Oregon, where some homes have neither internet nor cell phone service. So 3 million children is a lot to miss formal education. Did we make mistakes? I mean, everyone's been talking about restaurants, and I mean, there's a lot. I know there's a lot because there are parents who want their kids to go to school. There are parents who don't want their kids to go to school. So,
well, it's complicated, right? But, you know, I will say that we have learned a lot over the last year since the start of this pandemic. And there have been schools that have opened and been able to do that with all of the recommended mitigation strategies that the CDC has put forth. And what we found, and the growing body of evidence has shown, that you can get kids back into school safely by using these guidelines and these mitigation strategies without seemingly showing an increase in rates of COVID in that community, right? So meaning that the kids that are getting it are a reflection of the community transmission rate. So they're not passing it within the classroom, right? They're potentially getting that outside of the classroom at home. And so really, honestly, prioritizing that in-person learning environment that's controlled may even be safer for many of these kids and families than what they may be experiencing at home or outside of that. I will also say, even here across the state of Ohio, we've seen exactly what you reflected in that article. and that there's been a large disparity of who's been in person and who's been remaining virtual. And a lot of our school districts that are under-resourced chronically, maybe are more urban or serve either a more rural or a more minority population, have not been able to get back to any in-person learning. And those are the same kids actually too that, you know, really struggle as far as connecting virtually as well. I think we lost David, so we'll just give it a minute till he's able to join us again. I think you're still muted, David.
Okay, I think I'm back now. Okay.
All right. So what I was saying is that, you know, those school districts have had a harder time opening, the ones that are, you know, potentially serving either rural or minority populations that are already under-resourced. And then on top of that, those are the kids that likely have increased barriers to virtual learning at home, right? So they may not have a device for every student in the household. So I know from one of our school districts that last March, when we, you know, had to go virtual, they had many of their students that did not have internet, did not have a device, so weren't able to log on. And they were eventually able to get one laptop per family. But, you know, if you have a household with 4 or 5 school-age children and they're all sharing one laptop to do their schoolwork, what really is the, you know, quality level of learning on a daily basis? So I think that's been a real tragedy here. I can also tell you that across some of our larger school districts here, the daily attendance rate of logging in virtually has been about half of the students. So about half of the students aren't even logging in on any given day to virtual learning. So there's a real need here, and I think a sense of urgency to figure out how can we prioritize and make this happen equitably across all areas.
Do you think that teachers would have been more comfortable if they were prioritized for the vaccine?
You know, I think in some areas they even were. Some teachers in certain states have been put in that 1B category and prioritized for vaccination, which I think is great. We were so excited that that was acknowledged and done in some areas, but I don't think vaccination can be just the total linchpin to this happening and schools reopening. I think it's important. I'm glad they were prioritized, but, you know, to get this vaccination across to everyone, you know, all staff that work in schools, both doses, that's a big effort. And, you know, teachers and students don't live in bubbles. They go home to families. So even if teachers and school staff are vaccinated, but students aren't yet, of course, they can't get the vaccine yet, you know, they're going home to family members. So regardless of vaccination, we still have to have these safety measures in place, right? So that we're confident that when you are going to school, it's a safe environment for everyone.
Okay, so for those listening in, thank you. And please put any questions you have in the Q&A box, and I will read them to Dr. Bode. So what are the actual CDC guidelines for opening a school, and what is it for shutting a school?
Yeah, so, you know, the CDC guidelines really looked at 5 core mitigation strategies. So what are those things that you need to do to make sure that you're being safe? One of those, of course, is universal masking. I think there was a lot of discussion in the beginning around masks. Are kids going to wear them? And I can actually tell you from my experience in the clinical setting and clinics and to the schools I work at, kids are remarkably compliant and actually are often better mask wearers than most adults. So I think there's been many schools, both at the kindergarten level on up through 12th grade, that have shown that by having universal masking policies in place with students, they've been able to do it and have it be consistent. So that's the first one. The second one is around physical distancing. So this is tough. They started out with a recommendation of 6 feet or more of distance between students. And that is definitely the goal and it's the ideal, but that can be a challenge in some of our larger school buildings or older school buildings with the number of students. So some schools have been able to open up with that 6 feet a little easier than others. If you are not doing physical distancing of 6 feet, then within a classroom, they're recommending distancing by having small cohorts. So meaning a small group of students together that might stay together and not interact with other classrooms. That can really help, mitigate that risk level as well. One of the other mitigation measures is cleaning. So schools have done an amazing job with what they've done as far as high touch surfaces and areas, even like traffic control patterns, with one-way hallways, different things, trying to make sure that they can get the school ready there. Another one's ventilation. So really looking at the airflow in the school, what can we do, and depending on the weather, with open doorways and really good airflow in different spaces in the schools. There's been a lot of work around that as well. And then the CDC also talks about a way to identify children quickly who might be sick and developing symptoms and get them evaluated so that we can test and really do a good job at contact tracing and ensuring that we're following what's happening in this student body so that we know whether there's an outbreak that's coming from a classroom or not. So if we can put all of those things into place, and I think use those strategies and make sure that school staff is aware and comfortable, parents are aware and comfortable, that everybody is transparent and works on this together, that's how you get schools back open.
So I live right near a French school, which is obviously a very expensive school to go to. There's a lot of celebrities go there. They've never closed.
Of course.
But they also pointed out that financially strapped Catholic schools have been able to stay open too. So what's been the difference?
So I think the difference is definitely still resources. I think that really when we look at our education system as a general statement has really been undervalued and underfunded for decades. And so I think there was already a large disparity often around what resources school districts had prior to COVID, right? Whether that's Catholic schools, other maybe more resource private schools, charter schools, and some of our larger, urban or rural public school districts. And so even though the Catholic schools might be more under-resourced, they're still often smaller and have more resources than maybe some of these larger school districts with large buildings, large number of students. So you can imagine figuring out how to distance and be creative with your building and work on this for one school that maybe has 1,000 students versus a large school district that might have, my district here has 52,000 students. It's a different operation. And so I think that made it more challenging for some of these larger school districts. And the funding, they don't have the staff, the teachers, the transportation resources, extra classrooms to work with. So it's just been a real challenge.
So do students and teachers need to be tested? And if so, how often?
So there's a lot of different information about that in the CDC guidelines, and I think it's not a one size fits all. I'll start by saying that. So there are some strategies across the board in school districts or even secondary education and universities where they're actually doing weekly, asymptomatic testing. So they'll take a certain % of the population or students and teachers, and they will test them weekly to really get a pulse on what's going on, as far as rates of COVID within the school. That's really not necessary in every school district. I think what we really need is to have a process where if you are having students that are exhibiting symptoms or staff, what are the resources in your local community to kind of quickly get them tested? There's been a lot of great kind of unique collaborations, some with children's hospital systems or public health departments where they've actually been able to bring in the testing kits on site, and school nurses have been able to test quickly for students that are exhibiting symptoms. So do that COVID test before their parents pick them up to go home, so that you're getting the result, in an hour or that evening. And that is really helpful because that allows them to quickly identify the other students that may have been exposed, do that contact tracing, and really, protect that larger student body or staff. And it's worked. So even in districts that have stayed open, and schools, to your point, some of our private schools that have not been doing, routine asymptomatic testing, they've still been able to do this and show that they have not seen an increase in outbreaks or incidents coming from the classroom. So I'm not sure you have to do universal asymptomatic testing across every school district. If that's something that you have resourced, I think it can be a part of the plan, but it doesn't have to be. It should not keep you from going back to in-person learning. And I think that's the key here. If there's one part of these guidelines you can't maintain or do and have any in-person learning, then the prioritization should be to do the best you can and get back to what you can do for in-person learning for these students.
Is teaching remotely working for anybody? Do you think so? I mean, do some kids do okay with it?
Yeah, I do. I've actually had a few kids that have had some social anxiety, maybe some bullying, some other issues at school. And when virtual learning started and they were able to, kind of get away from that, and they're in a stable home environment with a lot of supports, they've actually loved virtual learning. For them, it's been a better option. I've also heard from some students that were really looking to move ahead more quickly, that maybe have been able to kind of, take extra classes or different classes, and been able to do that. So absolutely, I think for a percentage of students, this might be something that they would continue to do. And I think a lot of school districts already had that, where there was, even pre-COVID, digital academies and online learning schools. And the silver lining about COVID is many of these districts have probably amplified that curriculum, that work, that opportunity, that hopefully that will stay. So that if you're a parent that the best fit for your child is virtual learning, and you're still really nervous about getting back into the classroom right now, then that's still an option for you. And I think that's really important for parents. So I'm glad that that's happened. But I will tell you that for the majority of students, this is not the ideal way for them to learn. And for any child who's in that younger elementary age group, this is not the, staring at a screen for 8 hours a day is never going to be the optimal way for them to learn. Children learn by touching, doing, feeling, thinking, that interaction back and forth. They don't learn as well through that virtual environment. So even if they're learning from home, and families have done homeschooling for years, right, with this, but they've had family members at home that have been able to provide that piece of the education for those younger students. And not every family can do that.
So what's the mental toll on parents and the children?
I mean, it's a lot, isn't it? I have 3 kids myself that I have 1 high schooler and 2 middle schoolers. And when this happened last March, I come from a 2-parent working family, and trying to navigate that, I was so thankful that I had older kids that could, navigate this relatively easy compared to a elementary school student. But we had our own level of stress with this, and we're well resourced, right? We had all the availability to us of what we needed. When you are a single working parent, as an example, or you are coming from a family where you're an essential worker, you're working at that grocery store job, that gas station, food services, you were not able to stay home, right, with your children.
No.
And so you went back to work, you went to work every day, you put on the mask, you had that risk, and then you had your kids home, and what were you supposed to do to navigate that? And I had many families I saw that just had really tragic experiences over this time. where either they just couldn't work anymore and had to stop and go on unemployment and really lost homes, lost electricity, lost, I mean, talk about not having internet for your child with virtual learning. Many of them didn't have a home anymore. And so there's been a significant toll here. And kids are silent sufferers. We don't hear from kids, right? I mean, we don't hear what's gone on and what that toll has been. And I think it takes many months and investigation for us to understand that. And so, you know, we're going to be seeing, I think, the effect and ramifications of this for kids and their social development, you know, their academic development for a long time to come.
Yeah, I mean, also, so I have a daughter and son. My daughter has a 3-year-old and a 1-year-old, and she said it's very tough. I mean, obviously they're not going to. I mean, because my granddaughter could be at preschool, but my son has an 18-month-old, and he wrote me that I didn't know how hard it was to, be a parent with a child at home all the time. And I said, yeah.
Yeah, this isn't easy. And, you know, I'm a part of a virtual classroom right now for some of our middle and high schoolers at a school district with us. And often what we see is even some of these high school students or middle school students, when they're on their Zoom day with school, they might have 2 or 3 younger siblings sitting around them at the same time, and they're helping to watch them while they're doing their schoolwork at the same time, right? So we've actually had to be creative, and we've been instituting toddler reading time as an example in 7th grade curriculum, because it's an opportunity for the 7th graders to read to their younger siblings because they're right there. And so they don't have a quiet, separate place to do their academics all day long. That's not everyone's reality. And so, you know, this has been, I think, for every family, there's a different set of circumstances, but it has certainly not been ideal, I'm sure, for anyone.
And certainly school is more than academics. I mean, there's school sports, there's just being with other children, meeting other children and interacting. And that's also a way of learning, So.
Yeah, you're developing your executive functioning, that frontal lobe of your brain, all the way through really through college, right? Through about 22. And what we know is these school age years are so critical for so many different things. So it's not just the facts that you're learning, it's critical thinking skills, problem solving, how to interact with people, right? We already all have in the digital age, those teenagers we talked to about looking up from their phone, making eye contact, right? So that's a big piece of what they're learning in that peer group and peer learning. Other adults besides their parents and school staff, I mean, this is all critical.
What do you think of hybrid learning? Because that's going on. And what is hybrid learning?
So hybrid learning really means that you're doing a combination, right, of in-person and remote learning. A lot of school districts started with that because it allowed them to come back to some in-person learning, but reduce the number of students per day in a building. So they were able to have a little more physical distancing and really honestly get their protocols and their mitigation strategies up and running, which I think was helpful for many schools. It's not as ideal because it's really the routine is back and forth, right? You might, for example, have a week where you go into school every day and then a whole week off at home, or some just do every other day as an example. So it's a challenge for families. It's better than fully remote learning. It's, a half and half. That's what we're in right now in my school district. And it's definitely been better for my kids to go some of the days than none of the days, absolutely. And I'm just hopeful that with these continued work and community resources towards helping reduce COVID spread in the community and getting these strategies up in place, that we can get back to full in-person learning.
So I do know that schools have shut down. A lot of colleges, started and they shut down, and high schools also. And so what are the criteria for shutting down? I mean, in New York City, they said if it's only 2 kids, they won't shut down if it's only 2 children. So is it 3 children, 10 children, 15 children? I mean,
Yeah,
Have you,
I've been on a few medical advisory boards for our districts, and we've really struggled with this. And there hasn't been just one number, because part of
mhm,
that is when we've contact traced, even in some of the school districts that we've seen a few more cases, when we really take a look at what has happened, none of those students have gotten that while they've been in the classroom. There's been a clear exposure or contact trace that has been outside in the community, family gatherings. Sometimes athletics, as an example, too, that's a higher risk activity. But in-person learning in the classroom has really not shown to increase that. So I actually think there shouldn't be an exact number, because I think as you're taking a look at that as a school district and following the data closely, you can kind of see where that's coming from. And if the in-person learning environment is not the focus and it's stable and you can exclude and quarantine those children quickly, I think it's safe to stay open.
okay. What would you ideally like to see? I mean, besides every children back in school.
Well, every child back in school with, and that's going to happen because as a community, we're going to prioritize this, right? So
Mhm.
we should have, schools should be the first thing to open and the last thing to close. So if we're really trying to reduce community spread, we should do that so that we can have everyone back open. So you know what, if that means other services or other ways we gather don't happen, that's okay. We should prioritize schools being open. So if we can do that, and if every community member, even if you don't have children of your own, if you can reduce your risk overall so that these community rates can drop, that's really going to allow school districts to get back to in-person learning quicker and potentially all in rather than hybrid, because the community transmission rate will get low enough that we'll be able to have kids in school and they'll be able to stay in there with these mitigation strategies. So I think it's really an all hands on deck approach to sort of prioritizing this as this is the thing we have to make happen in our community, right? We have things we make happen. We have to make, essential services happen. School is an essential service and it should be prioritized that way.
So today they had at the White House the 50 millionth dose delivered, which is a great start. But there's a lot more than 50 million people in the country, and people need 2 doses for most vaccines. Um, and also, what about getting children vaccinated? When do you think that's going to start?
Well, I mean, 16 and up can start once we get to the point that we're going down in those risk strategies, right, to get healthy children vaccinated. Kids that are 16 and up that have special health care needs in some states are already sort of getting to that point where they can be offered the vaccine. But of course, less than 16, there's studies that still have to be done, right? So we say this all the time in pediatrics, but kids aren't little adults. They don't react the exact same way. Their bodies are changing and growing. And so you cannot just assume that something that's safe for an adult is safe for a child. That has to be studied and done separately. And so it's going to be many months before that's available to kids. And so we cannot wait for that to happen in order to get kids back into school, or we'll be back on the show in 2 years talking about some areas of school that still aren't all the way open. And we just can't do that to kids. We won't be able to bounce back from that.
So are rural schools doing well as opposed to city schools?
I think rural schools were hit incredibly hard by some of the virtual learning in the beginning. So they were some of the ones I think the hardest hit because they didn't have internet access. Sometimes just not because the family didn't have it, because sometimes the whole area doesn't have it. So we had some areas in Ohio where families would say, well, it's cloudy out today, so no school because we don't have any internet today from the weather. And so I think that was really tough because those were many areas where that virtual learning wasn't happening consistently. Some of those districts have been really creative at getting these guidelines up and running and getting kids back to school, but it hasn't been equal across all rural areas. And it's definitely still something that needs to be prioritized for them as well.
Okay. So I have one question. Please, this is your opportunity to ask an expert. So I'll start with this. As more children return to school with all the COVID safety precautions, What are you seeing in terms of incidence of non-COVID infections, such as the common cold, flu, etc.?
So across the pediatric healthcare system, as an example, so like in the emergency department and in the hospitals, what we saw during a time of COVID, right, was a massive reduction in other viral illnesses that kids can get. So, for example, RSV is a virus that many kids pass back and forth and can cause bronchiolitis, a wheezing condition. And really, that just dropped across the country. Partly at first because kids were home, right? They were separated, they weren't seeing each other. So, anytime you get them back together, we're going to start seeing some more of these. But right now, with kids returning to school with their masks on and having this distancing, we're seeing that it's helping prevent spread of COVID, but also every other illness that we typically see. So strep throat is a great example. I'm sure anyone that has school-age kids has gotten that note home that someone in the classroom had strep throat. Yep. And we haven't seen nearly the incidence of that we typically do, even in schools that are back to all in. And that's because we're cleaning, we have the ventilation, the masks, the distancing. So it's helping across the board with all of those viruses, which is great. So, hopefully it'll keep all of our kids in school as many days as they can be as they're catching up, right, on this academic and peer learning. So I'm appreciative of that.
It's good for parents too to have kids at school.
Oh, absolutely. Yes.
Yeah.
I can echo that.
This one comedian said, I like my kids. I love my kids. I don't always like them. So he's very supportive. So question here is, how long will we be wearing masks for? Dr. Fauci says until 2022. What do you think?
I definitely think likely still mask wearing next school year. I think that we're going to start the school year in the fall with masks still on. And I really think that the only way we're going to get out of that is when we have enough people vaccinated across the country, right? It's opened up, not the 50 millionth dose, as you said, but now the 500 millionth dose of vaccine. And it gets to a point where the rate of COVID in our community really drops below a negligible level. Then I think at that point, we're likely to give that up as a mitigation strategy, but I think we're a ways off from that. My daughter will actually tell you that now it's just like putting on her underwear. That's what she says in the morning. She just says, I just put on my mask. I mean, it's just what she does. And she would much rather do that and get back into school, right? So if we have to keep doing it in order to get kids back to in-person learning, then that's what we're going to do.
Now, I've had a lot of people from Sweden here and other European countries. They seem to have kept their schools open. And what are the lessons we can learn from them?
They prioritized it. I mean, we really have to fund our education system. So part of this, stimulus package coming out looks at $130 billion in education funding. I mean, that is so needed, and not just for this COVID relief, but we have to find a way to continue to prioritize and fund our education system so that we don't have this disparity. So when something else hits in the future, we aren't just, really just barely making ends meet for our kids with crowded classrooms, reduced staffing, all of those pieces that have been into place. So I think this is something that, we've cared about and been worried about for a long time, even pre-COVID, just around the disparities in equitable education for our kids. And I think that there's some work to be done there. And I hope that this pandemic has shined enough of a light on that everyone can see that something has to change there. We can't just go back to the way it was before.
So restaurants are starting to reopen. Next week, movies are going to be opening in New York City. Are these going to hurt school openings? I mean, what are the risks of opening other things and potentially getting more people infected? Because that affects schools.
That's exactly right. So I really don't think that we should be relaxing restrictions in other areas while still maintaining them in the school environment, right? So in my mind, we should be prioritizing getting schools opened first before some of those other things. I really think that, you know, you have a risk that happens throughout your entire day. So, and you shouldn't be adding on that risk. So, what I will say, for example, is if you're a family that has a student that's finally able to get back to in person learning, whether that's hybrid, as you mentioned in New York City, some of that starting, then what you really should be doing is prioritizing that as a family and then really thinking about how do I reduce risk in every other aspect of our lives, right? So I'm going to prioritize that my child's going to school. So maybe we aren't going out to the movies or we aren't getting together with other families or friends that aren't in our bubble, that my child wants to desperately, but they're not going to group play dates. Instead, they're focusing on seeing their friends in the classroom in school. So, your risk level adds up. And so you need to be prioritizing the in-school learning time.
Okay. So here's a question. What role do you envision for summer school this coming summer?
So I think it's going to be critical for so many students for some catch-up learning, but that's really only going to be able to be done if the district can be resourced to offer it and if it can be offered in a way that's an enriching experience. So do I think kids should stay on a computer screen 8 hours a day all through the summer? I really don't see how that's going to be beneficial, particularly for our younger aged learners. You need to be learning and outside and nature and play, and all of that is important as well. But if you had some in-person classroom opportunities, where you could be catching up on some of that academic work, I think that would be a huge benefit to many of our students.
So we now have a new administration, the Biden administration, and his wife is an educator. What should they be doing to help schools stay open?
So I think it's been, they've been working towards this. It's a start. One is funding. I mean, these districts have to get funded in order to be able to even do those mitigation strategies. So they need to have enough staff. They need to be able to have the ventilation system they need. They've got to be able to have buildings that are, not falling apart, that they can distance with in new areas. So, all of those pieces, those are critical. We've got to have testing opportunities. So if there is a district that doesn't have available to them quick contact tracing and identification, that's going to be an issue. And so I think funding for that is critical. And I think that funding needs to be targeted because you mentioned it earlier, David, but so many of our other well-resourced schools are already able to do this. And so we really have to target that funding towards, school districts that are having that disparity and make sure that we're lifting them up to get them to that level that some of our, private schools are already functioning at. And I think that's going to be really critical and important too. So targeted funding. And then I think continued focus and support around this. So again, making sure that we're prioritizing it and staying with it. So this isn't just going to be one lump sum of money and everyone's issues are going to be over. We have to be able to prioritize keeping these schools open. So it's open dialogue. There's COVID variants, things may change. We might have new challenges with how to keep kids safe in person. We're going to have to continue to follow that science and watch for it too. So I would say for the Biden administration, it's just continued high level focus on that and making sure that we have people that are really making decisions with kids' best interests in mind.
Okay, another question. Some parents are concerned about their kids not being able to participate in sports and are pushing for schools to open for that more than for learning. Is it okay to return to sports?
Yeah, this is really tough, right? Because again, you're prioritizing your risk. We have this in our area too. There are definitely, actually, often some of our school administrators will say that there's more chatter or angst over athletics than there is over academics from some, community members. I think that if sports happen, they need to happen safely. And athletics are in the guidelines too. It really looks at what mitigation measures can you put in place with athletics and what is your community transmission rate. So if you have a high community level and you have indoor sports and no one's wearing a mask while they're participating in that activity, then we're really running the risk that we're having an outbreak. And if that's getting counted in school numbers, is that going to, again, lead to some reduction in in-person learning? And that would be a travesty. So if you're going to do athletics in a school district, it really needs to be done in the way that the CDC guidelines suggest, the AAP suggests, and that's wearing masks during the activity, staying 6 feet apart, holding it outside if you can, depending on the athletic event, and really making sure that you're prioritizing the in-person school learning experience before the athletics.
Well, you're in Columbus, Ohio, which I heard has a pretty good football. There are a lot of
Yeah.
football fans there. Yeah.
Yeah.
My family's from Ohio. Speaking of educational catch-up, do you think kids should be tested to make sure they have mastered learning objectives for each grade level before moving on to the next grade level? Do you think if there are some children who show deficiency in grade level learning objectives, they should be held back, or should they be moved forward?
So I think that's going to be, first of all, I will tell you, of course, I'm a pediatrician, not an educator. And I work hand in hand with our educators, and certainly they have more experience than I do, right? And how to catch kids up and take a look. But I think what we're going to see is a large number of kids across the board that are going to be falling behind in this, right? So meaning that instead of 1 or 2 students that may be held back, you might have a large percentage of a grade, right, that is behind. And so I think what schools are going to need is a lot more tiered learning opportunities as kids get back in the fall to in-person and they're doing their new assessments for the next grade level, because they're going to have to be able to potentially keep them at those same grade levels, but be able to offer that differential learning to get everybody caught up, but to allow the ones that maybe have been able to stay ahead to move on. And so what does that take? Well, it takes more resources, right? We're going to have teachers and staff that are better resourced, that there are more of them, enough of them to be able to provide that. And so I think that's a part of that, focus on education and making sure that we're funding it to a degree. We can't just take large numbers of students and hold them back, particularly if the school environment is still going to be partially virtual in the fall. If we don't get kids back to in-person learning, we're definitely going to have a mess on our hands there.
So as you know, as a parent, kids are little germ breeders. I mean, I was always sick when when I had young kids. Well, so what happens when kids get COVID? I understand they get mild cases. Are they mostly asymptomatic?
Yeah, the vast majority of kids have either no symptoms at all or mild disease. It has been a small number of children that have shown more moderate or severe disease. A very small percentage of kids that have needed to potentially be in the ICU or have issues with, inflammatory reactions of their body. So it's not zero. I mean, there have been cases of kids that have gotten fairly ill from COVID, but well over 95% of kids that get that are either no symptoms at all or mild symptoms. So they do react differently. Again, kids aren't little adults. So when they get viruses and different diseases, they manifest very differently in kids than they do in adults. And so we're learning as COVID, continues to, and we're going to be continuing those studies in kids as well to take a look at what are the treatments. Can we identify reasons why kids, that very small subset, might get sicker? Those are all things that are being studied right now and are going to be important. But yeah, the vast majority of them do fine. And part of kids growing and being those germ factories and getting all those illnesses is actually not always a bad thing. They are developing their immune system too, right? And so as they're growing in those younger ages, some of those colds and viral illnesses aren't always bad. I'm not suggesting that that's the case for COVID and that you should get your child, to have COVID. at all. But I am saying that there's other viruses that it's not always a terrible thing for your child to get some of those illnesses.
So no COVID parties like there were chicken
No
pox
COVID
parties.
parties, please. I don't want anyone to think that that was anything I was suggesting.
Okay, I'm sure that. How contagious are asymptomatic children to their parents and grandparents?
So we don't know exactly the numbers yet, right? Again, that's ongoing literature, and some of it depends on what we think is viral load. So meaning what was that exposure when the child got it, and what is their viral load at the time? And you can still be asymptomatic and have a potentially a high viral load and pass it on. So it's definitely not zero. And we certainly have to be careful and concerned about kids that could get COVID if they're particularly living with a grandparent or someone that's not well or has healthcare needs or is incredibly high risk, because that's a concern. So those are things that I think every family is having to deal with right now as they think about kids returning to in-person learning. So you had mentioned options before, and if you're a family that maybe lives in a home where you have, someone who's incredibly high risk and you're very concerned about your child going back to in-person learning because of that, you'd want to be looking at those mitigation strategies, and then you have to make your own decision, right? Of course, as a family, about whether you're tolerating that risk level. But I would say is look at all the other risk in your life too. So if there are other risky activities that you guys are participating in, I would limit all of those first before you give up the in-person learning. But again, some of those decisions are very individual.
So, we've had, in this country, unfortunately, anti-masks people politicized. There are people who have told me, and I don't take those questions, but people said that they heard that vaccines are a conspiracy. And do these things, how are kids, at what age, first of all, at what age should children be wearing masks? Should 2-year-olds wear masks?
Yeah, 2 and older can really safely wear masks. And again, kids are so good at this. So
Okay.
if they're in an environment where it's set and it's an expectation and it's positively reinforced, 2 and 3-year-olds can wear masks pretty consistently. The only kids that really can't wear masks are often kids that have either cognitive disabilities or other physical disabilities where they really wouldn't be able to remove the mask or have, breathing difficulties with that. But that's a really small percentage of kids. Kids are pretty good at doing this, and they don't watch all these political things. So
Okay.
once they get in an environment where that's the expectation and it's set, they're pretty good about putting it on.
So I've been told if I want to see, it's much safer to see children and grandchildren outside, which makes sense to me. But unfortunately, it's been a cold winter, so you do Zoom talks or WhatsApp or whatever. Do you fear that children are not really getting the benefits of, not only not seeing other children, but not really seeing other families, not seeing grandparents? That's a cost too, I think.
I think it is, I think every parent will definitely attest to this, that kids act differently around you than they do around other adults, right? So the kids and the personalities that mom and dad get at home are very different than how those kids might interact or behave or, act with grandparents or other trusted adults. And there is something about that relationship and that ability for kids to develop those relationships. And that is, it's with grandparents, aunts, uncles, other family. It's also with teachers. It's with adults, right? That they know and love and are that trusted adult in their life. And so I think there is a toll there. I think that's sad, right? Because kids don't do as well with maybe those social Zoom calls. They don't love them, right? Sometimes
Mhm.
it's hard to keep them in the camera angle for the younger ones. So you do the best you can right now. That's just what we're faced with, I think.
So is having husband and wife and children, or single parents and children, are families getting closer, or are they ready to kill each other?
Oh, I guess that's probably going to depend on the family, huh?
Okay,
For
yeah,
us, you just have to ask. It just depends on the day. You ask us, right, how it's going.
right, yeah. I mean, I know that, I used to get report cards, oh, your children are so well behaved, and I'm thinking, who are these children?
Exactly. And
Yeah,
that's what I'm talking about. That
yeah.
structured environment with expectations is very different. And
And for the record, my children were very good. Okay. Most of the time. Yeah. So,
yeah,
so I mean, we've also read that, the people aren't meant to be together. Families aren't meant to be together 24/7. I mean, I went to high school. I would be playing ping pong with friends. I would never be home. I'd go on bike rides. I would go play tennis. I would, we had after school activities and things. And I think all these things are important. So the middle school kids are going back to school. What about the high school kids? When is it going to be safer for them to go back to school?
well, I think it is now if high schools can get those mitigation strategies up and going. And I actually think I know that the younger kids really struggle with virtual learning. And for a high school student, that might be a little easier to navigate, of course, right? They understand the technology, they can get on. But they are missing out on everything you just mentioned, right? They are developing their own sense of self, right? And their peer interactions and the type of person they're going to be, and that part of their development, their social emotional development, is still critical at these years to be around their peers. It was important that you went and played tennis, right, with your friends. It wasn't just fun. It was a part of your growing identity as a person and that situation that you did. So I think, we've got to be able to prioritize the high school students too, to maintain that. Absolutely.
So I always like to end by asking people, what do they do? So do you do indoor dining?
Indoor dining. We have not really been indoor dining. We have picked up, I will say, I am not always a chef in my house. So we have definitely tried to support local restaurant business and done a lot of pickup. We did when it was, we did eat at a couple places, I would say, when it was nicer out and outdoors in the fall, but have not done that as much recently.
Okay. Do you visit other families?
So we have visited some. My mother is vaccinated, and she actually had visited us even throughout this whole pandemic period. She had chosen to continue to see us during this time, and that was kind of a choice of hers. And then my other set of in-laws, actually, we do see now because they actually both ended up getting COVID, not from us, a few months ago, and now are getting vaccinated. So we're back to doing some in-person visitation with them as well. But other than that, not really family, no.
As you know, we have Governor Cuomo, and he was always saying, "Don't visit grandma." I don't want you
Well,
killing my. Yeah.
we were just right there with him. We have some elderly, parents, that we were so concerned that if we unknowingly, passed it on, and even though we were asymptomatic, that would obviously just be tragic. And so we did not see them for many months. And it was hard. Thanksgiving was hard. All of those decisions you make where you're just not getting together are really tough. But we did what I think a lot of people did. We did those Zoom calls, and got to see Grandma and Grandpa through that. And that was great for a while, but it definitely is not a replacement of finally getting back together. Absolutely.
No, it's definitely not. Yeah, I mean, it's always interesting to me that you do these calls, and after a while, people, they call it Zoom fatigue or whatever. It's and children are that's not how they relate to people. So, what is your advice to? Okay, so there are some parents who are really frightened to send their kids to school. How do we get them over that?
Well, They have to have trust. They have to have trust in their school administration around what are the measures they're putting into place. So
Okay.
I think parents need information. It needs to be transparent, right? They have to know in the school reentry plan all of the different pieces that are in place. And if they feel like they're not following those, guidelines, or that they're not being transparent about what those are, then, maybe that is a concern for them and they would make a different choice. So I would say it's really engaging with your district, and it's information, making sure you know exactly what's happening.
So the private schools have, as we've noted earlier, have done very, very well. So should we be funding them and having them accept students who are not very wealthy and just saying, bring them there? Is that some solution?
It's not a solution because, again,
Okay.
those might even be smaller buildings. I mean, they probably don't have the capacity to do that. And really what we should be doing is funding the other districts to a level that it's not challenging for them to meet those standards.
Okay. So what do you say to union leaders who, in New York City, we have a very powerful teachers union, and, there are teachers who have said to me, I'm older, I'm frightened to go back to school, just like there are grocery schools, people. So how do we convince everybody that this is a great idea?
Well, I mean, first of all, it's starting with the dialogue. So absolutely, we have to understand, like, what are the specifics behind that, right? So it's really working with, the unions and the teachers and the staff and school administration to look at what are all those pieces that have to get put in place. And again, it's that trust between both, that we're all working towards that goal of getting back and doing it safely. And so I think it's trying to continue to sit at the table, engage, and talk through it detail by detail. I've been in a lot of those conversations. They're really important. And we've got to keep them going because teachers want to be back in person and teach. They just want to be able to feel safe doing it, right? But they're educators. They do this because they love it and they want to do it. And so what can we do to, again, get resourced enough to say, okay, we're going to open, but only because we're putting all these things into place, and get to the right place with them. And I think that needs to happen.
So as a pediatrician, should pediatricians be encouraging, should they be talking to parents more? Should they have informal, like, just say open mic night with, on Zoom?
Yeah, we do this. That's what I do all day long. So I do it
Okay.
with families I see in clinic on an individual basis. This is something I'm asking about every single visit that I'm seeing with a school-age child. What's going on in your case? Are you connecting virtually, in person? What is your situation? I talk about those safety measures, and then I present to school boards. I present to family, engagement nights with school districts. So we can be a resource. I think pediatricians are a great choice for that, and we can keep advocating and educating with our families.
Okay, so we've come to close about our time, and I'd like to really thank you, Dr. Bode, for spending time with us and enlightening us about all these issues. And I think everyone would be better off having kids back at school.
Yeah, thanks for having me. Appreciate it.
Thank you. Stay safe and enjoy your children as much as can. I'm sure you look forward to seeing them all in school. Okay.
Yes.
All right. Okay. Take care. Good night.
Thanks.
Good night, everybody. I just want to say before I leave that next week I'll be speaking to Catherine Eben about the Food and Drug Administration and what happened during the Trump administration. And it wasn't the easiest thing. And that's March 3rd. On March 11th, I'll be speaking to Carl Zimmer, who has a new book out. And on March 18th, I'll be speaking with Sherry Turkle, who also has a new book out. And so we look forward to you joining us for those talks. And in April, we'll be doing another one on dating and COVID. Okay, take care and everyone stay safe. Thank you.